we have everything figured out for you. Many of you come from outside, so definitely many of you have also wondered, where you're going to stay, who's going to take care of you, and all of this. And luckily for you, we have figured all this out, and we do it under our own supervision, which is something that not very many people have available. So know that is very important. Next time you are considering these things, make sure you pay attention to these details, because when you go to have, our results, what we can do. But that's not the most important thing. The most important thing is also figuring out everything else around your surgery in terms of safety, in terms of recovery, and all of this is extremely important. So be mindful about that when you're having your surgeries or considerations, so you can have surgery and be safe. Okay, we will take care of you. We will watch you for a week. We will provide you assistance. We'll go see you. We have a nice hotel where you can recover. All of this is very comfortable compared to other practices where you're gonna have to figure it out on your own. Once you leave the surgery, they don't have any more contact with you for a while. A lot of times people cannot get access to anybody. So, it's important. So let's see what we can do. Let's see. Very good. Let's see. So we have some questions coming up. So here is, can you still do it for, I guess, I don't understand what type of surgery, high BMIs. So BMI, again, we go over BMIs. BMI is called body mass index. It's a relationship between your height and your weight, and it tells you which procedures you can have done. If you go to topaesthetics.com/BMI, there's a beautiful page where you can access a lot of information. You can calculate your own BMI. If you don't know how to calculate it, you just put your height and weight, and it will give you the BMI, body mass index. It'll give you a lot of recommendations about what we do or what we can do. They have very nice little schematics that we have prepared for you to see what you're candidate depending on the BMI that you are. But again, BMI it relates to the relationship between your height and your weight. And if you are a very high BMI, over 40, you can have surgery. Before 40, maybe you can. So, but it depends on what procedure. Usually for tummy tucks, you should be 32 or below. Some patients need to be below 30. Some patients may have a little bit more and still be candidates. But to have a great result, it's better to you're closer to your normal BMI. Normal BMI is between 18 and 24 or 25. Do you do virtual consultations? Okay, so the consultation process at Top Aesthetics, very, very simple. There's a free consultation process. You go to Instagram, click the link in the bio, go click where it says free consultation, fill up a very quick form, send some pictures. Very important to send some pictures, because without pictures, we can't give you a good assessment. And then you can, there you go, then you can, within 24 hours, you should receive a personalized quote for you with your plan if you submitted the pictures. You can also go to our website. You can interact with the chat in there that will guide you through the intake process. But it's very important that you submit pictures as soon as possible. So if you do that, that's a free consultation. If you want to book time to speak with us, with the surgeons, then you can do that, but there's a price for that. So there you go. But you can have a free assessment by the surgeons if you submit your information. I had surgery almost 2 weeks ago, and I want to know, you're awesome. Thank you very much. If you want to join in, Kira, and show us your results, it'll be great to talk to you and tell us a little bit about your experience. I live 15 minutes away. Do you have to use the package is still a great question. So if you're a neighbor and do you need to use the packages, the stay packages? The answer is yes, because although this has been designed for patients that come from abroad, it's extremely beneficial for any patient. First of all, because we're gonna watch you, during the first hours, the critical first hours, especially the first 2 or 3 days. Second, you're not gonna bother anybody that is gonna need, to come and take care of you. If you go back home and your husband is there or your partner is there, believe me, that's horrible for you, horrible for them. You can't really take care of the kids or the dog and everything else you do at home. So it's better to reserve your time for you to recover. The comfort of the hotel is much better. We're gonna have trained people to take care of you. So the answer is yes. Even if you're a neighbor, it's great for you to stay with us in our premium stay package, especially if you're having any sort of liposuction or BBL that requires massages, or you're having a combination of procedures that is, a little bit more difficult to recover from. If you're just having like a breast augmentation, then you could potentially go back home, just do the standard package, and then you go at home the next day. But if you're having something else that needs massages and care, then definitely, stay with us. How long should I stay after surgery before traveling back? The package that we have is for 1 week. So that's how long you should stay with us. You could stay longer if you could. If you're having a tummy tuck, for example, you might have a drain placed. So the drain is not gonna come out before you leave, even if you stay 2 weeks. If you stay 3 weeks or so, then probable. But 1 week is is a good time to stay here, and that's how we have designed the package for, even if you're having combined procedures. How often should I get massages when I go home? We would recommend the massages to be every twice a week for 2 months or so. So a lot of patients buy these 10 to 15 massage packages after surgery, and I think that would be very reasonable. And those massages help a lot with your fibrosis, with the resolution of your inflammation, and I think it's definitely a must when you're considering this. We include your first 3 massages while you're at the hotel if you do in the premium stay package with us, so you don't have to worry about that. Some patients add a couple more if they're staying the full week, and then that's great. And then you can continue that when you travel back. Let's see. Do you recommend silicone or saline implants? Definitely silicone. Okay, saline are stiffer, more fake looking. So if you like that, then you could probably just use saline. I disfavor the saline implants because I think it's an older technology. The newer technology for silicone implants feels more natural, looks more natural, and the technology is better. So how much fat can you extract from Lipo 360 I like to look super skinny? Well, there's a limit. It all depends on where you start. So I think it's important where you start. We can remove 4 liters of fat. We usually remove about 5 liters, including some of the fluid, or sometimes a little bit more just because it has fluid, but 4 liters of fat. If we are doing a combination of procedures, then we can remove about 1 liter of fat, which in patients with lower BMI still is a decent amount. But the good thing with Top Aesthetics is that I or the other surgeons will look at your pictures and tell you the best plan for you. So how much fat, let's see, how much to talk to us. If you're doing a book consultation, we charge the same as the booking fee, $500, because that means that you have already paid your booking fee if you decide to join and you really are considering and serious about this, so that's how we have implemented that. You worked on my friend today. Now I want a mommy makeover too. All right, good. We did some beautiful mommy makeovers today, and a couple of patients that we did a mommy makeover look really good. That circumferential body lift, amazing. Do you charge for hernia repairs? It depends. It depends on if we know your hernia repair is there. It's a large. It has to be usually like a large hernia repair. Sometimes those cases could be a little more complex, so we might add a complexity fee for those cases. But we have to see your particular case. A lot of times we find what we call incidental hernias. So meaning like when we are doing the tummy tuck, there's a small hernia repair in the umbilicus or something like that nobody knew, that it was there. We'll obviously repair for that, and those usually don't have an extra charge because that do not require a significant amount or lengthy time. But if you're known to have hernia repairs or hernias or they're large hernias, then it will be some kind of extra work. And luckily, I have a lot of experience doing that, so we can definitely do it safely. Let's see. Where can I find messages? See how much for BBL implant. Okay, for all the pricing related questions, just remember to send us your consultation. It's very hard to give you just pricing out of that just because we don't know exactly everything you're gonna need. But if you give us your information and your pictures, then we can put together a plan for you, and we'll promise you we'll send you within 24 hours your quote. So do you personally do rhinoplasties? Yes, I do personally do all my surgeries. So rhinoplasties is one of the surgeries I do. So definitely rhinoplasties is a surgery that required a lot of details, so it takes some time, and yeah, of course, if you are interested. Now, I don't like to combine head and neck procedures with body procedures, especially something like that. Certain procedures we will combine them. For example, like fat transfer to the face or buccal fat pad removal or things like that. Those are easily combinable with body procedures. But more complex procedures like facelift, neck lift, blepharoplasties, rhinoplasties, things like that are not really a good to combine them with the body procedures. Because remember, for body procedures, a lot of times we had to flip you over, and then you don't want to have your blepharoplasty and then flip over, and then you woke up and things are not going to look good, and you're going to have more swelling, and yeah, so not a good idea. But again, we definitely can do all those procedures. How long do you have to be in town for a breast augmentation? So breast augmentation, we would recommend just a breast augmentation or a breast lift or a breast reduction, just that procedure, single procedures that don't require any significant massages and so forth. You do the standard stay package, just 2 nights. So the night you come the day before and you stay until the day after surgery. That would be kind of the normal thing. That's why we have that package. But if you're having liposuction that requires massages, BBL, or any sort of combination of procedures, even a tummy tuck, things like that, then thinking about staying with us for the full week. You will not regret about that, and you will regret about not doing it. When do you use a tummy tuck scar silicone shape? Okay, the silicone taping or the silicone sheets for scar management, for tummy tucks or for breast or for whatever scar you're doing it for, you should probably start about a month to 6 weeks after, when everything is pretty well healed, and then you can start using that. That is a great way to go about managing your scars.
All right. Hola. Hi, everybody. How's it going? I'm everywhere.
What's up,
so many sites today. Wow, we're everywhere.
Yeah, right?
This is big. Guys, listen, I just read a question because I'm helping the doc out with the question of do you need exams prior to surgery? Now, here's the thing. We invite you to watch our YouTube channel because there's a lot of information in that. But precisely today, you didn't do your homework because I posted in all the social media, Facebook, Twitter, and TikTok. I posted a video, a pre-op video of Jordana speaking of the things that you need, the clearance, what do you need to get, what do you have to be prepared for surgery. Everything is there. So if you're curious, if you have these questions, and the only reason I'm saying this is because I want you to take advantage of the doctor to ask him things that are not in the video. All those questions, they're all responded in the video. They're like 2-minute videos, like in and out. Instead of watching Netflix, a really bad series, you go to these videos, 2 minutes each, and that's it.
That's exactly right. And I'm happy to come here live and answer all your questions. But know that 90% of the questions that you ask me and I answer you here, they are on the videos. I'm happy to answer it for you here, but it's a great resource, like Ceci said, that you can tap into and look for, because there's definitely a lot of content that we create for you to access it and hopefully answers a lot. We know it's very, very useful because I see it in all my patients when they come here. First of all, they have a lot of more information, and then they really feel like that they know us better, because they do, because they've been watching our lives and also our videos. So it's a lot of good information. Okay. Again, I talked about BMI already. If you want more information, topaesthetics.com/BMI. And then you have all the information you need in there, or watch the videos, because that one I already answered it. What are your thoughts about BBL and a deck shop sitting 5 to 6 hours with the BBL stay intact? Yes, I think so. You just have to be mindful of the first 2 or 3 weeks, and we'll give you the BBL pillow, so you can use that, and definitely, that's a good help. So if you use that, you should be perfectly fine for a BBL, even if you have a sitting down job. How much for mommy makeover? Again, all the pricing questions, send your consultation. Free consultation. Send your pictures, fill out your information, we'll send you a quote. How many circumferential validators do you have done? When you do a urinalysis, a urine test, and they found blood in the urine, and they usually give you a cell count. So they count how many red cells they can see in a field of the microscope. And when it's a lot of blood, it says too many to count. Okay, that's the amount of circumferential validators that I have done. Too many to count. So very many, can count them.
Okay, this is a question for me. Thank you for considering me in this. You're asking me, I think it was Bianca, Ceci, can you please post more pictures of before and after of the brachioplasty? I will search very deeply. We do have a lot of those pictures, but you requested it, and I will look for them. Maybe not this week because we have all things scheduled, but next week I will post some of that, because we do that procedure. It comes out really nicely. Many patients choose that. Some of them add it last minute. So yes, I promise you that I will deliver. If I forget for any, just send me a DM and I'll do it for you.
Yeah, and we can post it on the stories, although
Sure.
That is a little more fluid, so we'll definitely keep it in mind and post it on the stories. So if you stay tuned to our stories, we should be posting some of that while we are programming to post in the feed. So I think it's a good idea. And if you have any special requests like that, then definitely great. Just let us know, and then we're happy to post something that you're more interested in. Okay, so here, let's see. Can I do a tummy tuck, a 360, and BBL at the same time? Yes. So we do this combination of procedures very often. We do a tummy tuck and a BBL, tummy tuck, BBL, breast, breast lift, tummy tuck, breast lift, BBL, all sort of those combinations. Definitely, we have it. Definitely, you can do it. We can do it in a very decent amount of time. Let's see. Do you require us to do exams before being considered for candidate for surgery? We answer that one. Definitely, we do. We have a very complete preoperative process, so definitely yes. Man, too many questions. Can I come by myself to do surgery, or I need someone with me? It's best if you bring someone with you. If you plan it with time, you can come on your own, but you need to schedule assistance for the first 3 days at least, like full-time assistance, and it might be a little more expensive than bringing someone with you. So yes, there is an alternative. You can we schedule with time. We can probably cater that or arrange that for you to have a dedicated person to stay with you at least for the first 3 days. So definitely it's possible, but please make sure you let us know with time, and it's always best if you can bring someone.
Except your pets. No dogs, okay? Guys, you're asking about financing options, and I want to make sure that you guys know that you have like really great opportunities. We finance with Care Credit, and the first year they don't charge you anything, like no interest. So let's say you finance the surgery for 2 years. The first year you pay no interest. So basically they're giving you money for free for a year, which that's pretty cool if you get a big surgery. And then we have Alfian, meaning there are options. If you have doubts, DM us and we'll send you the links. On our website, topaesthetics.com, you go to the financing options and you have the links there that you can check it. But fear not, there's many options. We can help you out. And if you have any doubts, please DM us.
Yeah. We have also a financing section there in the website that is actually cool. If you check it, if you click the link, it will tell you, will take you to our designated area for the financing, for example, for Care Credit. And then you can just put the amount of money that you want to finance, put, how much time, or 2 years, 1 year, 5 years, whatever the options are, and then it will actually calculate for you the payments that you have to make. So it's actually pretty cool. Check topaesthetics.com financing, and look into the options. Click Care Credit and you'll see that. I am 5 months out of a circumferential and I'm in love with my results. That's awesome. We'll see you in August for brachioplasty and breast augmentation. Looking forward to that. So for those patients that have lost a lot of weight, they're massive weight loss patients, and they usually require staging procedures. So this patient came in for a circumferential body lift, BBL, maybe something in the midsection. Then the next time they come back for the breast, the arms, the back, sometimes this excess skin here, and then finally we can finish with the thigh lift. So those are the usual ways to do it. Like this patient here that she's coming back, and if she's around and she wants to share her results, that'll be awesome. I'm getting an extended tummy tuck, BAM, BBL, and chin lipo. Do you think a week is long enough to recover? Yes, it's long enough to stay with us here. A week will be perfect. Is there such a thing as makes your cheekbones pop off more? Yes, it's called fat grafting to your face, and it's amazing. And so, great procedure to add to that.
Sorry to interrupt. Very important. I didn't want to interrupt, but somebody popped out and say that the Care Credit, that they don't charge you the first year, they charge it all together the second year. That's not true in our case. Maybe other clinics do that, but in our practice, we absorb that interest. So you don't have to worry about the first year. It will not be charged all together in the second year. If you have doubts, again, DM me in any of the accounts, Magic Surgeon or Top Aesthetics. I can go over that with you. You will not be charged what you did not be charged, where you weren't charged in the first year. Make sense? If you're worried, if you're concerned about that, if it happened before in other practices, please DM us and we'll help you out.
Perfect. Well, you have to pick the program that you want. There's 12 months without interest, meaning without interest at all, but you have to pay it in 2 months. If you pay it more, then you might incur in some interest. So those things, just read very well what you're doing and the financing terms. So we're happy to guide you too. And your coordinators will help you out and guide you through the process. Do you require, so about popping up your cheekbones, amazing. Fat grafting to the face, great procedure to add to your other procedures. It's gonna make your cheekbone stand out, make sure you don't need any more like fillers and all that. If you did fillers and you like them, you most likely will love fat grafting to your face because it makes it.
Hi, Dr. Paladino.
Hey, Bianca, how are you?
I'm good. I'm 5 months out in my circumferential. I'm still wearing my faja.
Very good.
Let me see you. Let me see you. Let's see you.
Yeah.
Go further back just a bit so we can see you better.
And I'm going to go back in August for my brachial and my breast augmentation.
Awesome. Yeah,
I am a 2-part massive weight loss patient. And I will be going back, and I will be staying a week, even though I'm local.
Good
Listen,
job.
Bianca, can we ask you, is it too much to ask for you to take the faja off? So we can see it better, so the people can see it?
I have layers, because I don't like to... I like to put something in between me and the faja, and I have my belly board also.
That's awesome.
Yeah, that's perfect. But because you know what? People really want to see it, the procedure. So with that, we can't really appreciate it.
But look at, you look good even with all that stuff
on
you.
Yeah, of course. No, of course.
Yeah, I have layers, so I'm actually smaller than
So tell us.
And I'm going to work. So I'm going to be wearing this for 12 hours.
That's awesome.
Oh, wow.
Yeah. And you have lost how much weight?
I lost
Wow.
107 pounds.
Amazing.
Oh, wow. That's amazing.
So she lost more than 100 pounds. It's nice to show, you know. Like,
Do you have a BBL as well? I'm sorry.
I do.
Oh, Lord. Again, you're just
Yeah,
rubbing it in my
she's
face.
cheating. She's cheating. No, she looks amazing.
Wow,
You
you
know,
look amazing.
yeah. So you know, when we do the circumferential body lift, I always
Wow.
like to inject. Yeah, looks amazing.
She looks amazing. That scar line is superb. I can't believe it.
Yeah.
That looks really good.
No, you definitely
Yeah.
look amazing. You know, and this is a perfect example, you know, of when you massive loss patient, that's the midsection first, and then you wait and come back and do this, and you stay with us, right? So you stay here at the hotel.
And
So
I'm already back to the gym. I go 3 times a week. I'm doing weightlifting. It's not bothering
Wow.
me in the least. I'm trying to tighten my arms and my legs as much as I can before I go back for my second procedure.
amazing.
Good.
Yeah,
Bianca, good work. You look amazing.
Yeah, seriously.
I'm taking care of the body.
Yeah, I can see that. You look like you've been in the gym forever.
Absolutely.
Amazing.
I tell you, like, this is the things that you want to do. You invest a lot of money and time, you know, in what you're doing, and then you want to take care of that. You definitely, that's exactly what you should do.
We can't bounce back. We have to keep it going.
Yeah, no, this is amazing. No, thank you so much for tuning in. I did 2 circumferentials body lifts today. So,
Yes. And it wasn't as painful as I thought it was. The Expro was great. I think I took 1 Percocet before the massage, and I saw it was making me nauseous. I stopped taking it. I took Tylenol, and that was it. 1 before the massage,
amazing.
and I was fine.
Imagine that, you had a pretty big procedure, and now you just do 1 Percocet. So yes, definitely Exparel helps a lot, especially with the body procedures.
It really does.
It's a really good option, and it minimizes the, all the problems that taking narcotics will give you, because Percocet makes you feel, makes you constipated, makes you dizzy, gives you headaches, things like that you don't need after surgery. So
yeah, it didn't make me feel good, and then it helps with the pain so much that you can really move post-operatively, which is important too.
Absolutely. I'm so happy that you're doing so great and you're taking care of yourself, and I'm really looking forward to the next step. It's really.
Me too.
That's awesome. And you waited about a year and a half, right? Or a year, more or less?
No, I did it in October.
October
4th.
That's amazing. So you're gonna even do it like in less than a year. That's awesome. That's amazing.
Yeah, I'm gonna be like 10 months out when I go through the brachial and the breast augmentation.
Perfect. When you're doing surgeries in another surgical site, like for example, we did surgery on the midsection, now you're doing the breast, the arms, you can do it really, definitely within 3 to 6 months. When you're doing surgery in the same surgical site, like if we would do like Lipo or something else, then in those cases we'll have you wait maybe closer to a year, like you're doing it. But definitely great, very amazing. Good to see you. Thank you for sharing. Yeah,
Thank you.
It looks amazing.
Que tenga buen día. Gracias.
Gracias, Bianca. Nos vemos.
Bye.
Adios.
So patients are asking, why does the scar line go all around? Do you want to explain the differential?
So yeah, let's explain a little bit, why her incision goes all the way around. It's called a circumferential body lift. It's actually lift your whole body. Patients that lose a lot of weight, everything sags all the way from the top to the bottom to the back. So we need to lift the buttocks, lift the hips, and obviously do the tummy tuck. So in those patients, the best procedure to be performed is the circumferential body lift, which is the buttock lift, the hip lift, and the tummy tuck. It's kind of a combination of 3 procedures in one. So definitely a good procedures to be combined. Let's see. What else? A lot of questions.
Yeah.
I did this once. I can camp by myself. I did that one. Do we just tell you what we want, or just show you pics the day before? In terms of, so it's always, let's talk about the wish pics. So it's important that you bring your wish pics, because I take a look at those wish pics and I try to get it closer to what you're looking for, especially, for example, when we're talking about breast size. So we're talking about breast size, it's definitely better to bring some wish picks so we can pick the right size for you. I'll tell you what size you need based on the picture that you show me how you want to look. So that would be the best way to go about that. When do you get the fat for where do you get the fat for a skinny BBL? Where skinny BBLs are done usually on skinny patients and they don't need much fat, but we usually get it from the same sites. We get it from your abdomen, your flanks, your back. Occasionally we may get some from your thighs or your arms if you have some in there. Skinny patients, we usually have them, from those areas. So definitely that's where we get the fat usually for these procedures. What if you're booked for a combo procedure such as tummy tuck and BBL and there's an option to change breast augmentation procedure to a BBL? You can definitely do some changes. I'll have you discuss that with your coordinator, and I'll definitely get involved if I need to, if they have any questions.
Okay, so you guys are asking about the ProCare coverage, which is called the ProCare package as well. We used to have something called Cell Saver before, and it was $500, and it would help you. I have to read this because I'm not good with terminology, medicine terminology. It recovers the blood lost during surgery and it retransfuses it into the patient to improve blood levels.
Well,
Oxygenation.
that is actually what used to be. The cell saver is that it's an
Yeah.
auto transfusion from the blood that you lose. Instead of throwing away, we actually reprocess and give it back to you if necessary, if you're losing a lot of blood or your blood levels are low. So, but we decided to put in the same fee a lot of more things, which is the ProCare coverage. We covers, things that you may need. For example, if you do the ProCare coverage, we will actually monitor your hemoglobin continuously during the surgery. We have this technology that is a non-invasive technology that allows us to see that, how much blood are you losing, and be mindful about that. Also, we have the possibility of giving you blood transfusion if we need to. We'll monitor your EEG, your brain function as well during the surgery to see how asleep you are. And then if you are to need like cell saver or an ultrasound or antibiotic treatments or something extra, it's all included in this ProCare coverage. Not very often, but occasionally patients may have a issue like a hematoma, or they might need to go back to surgery. And since we are taking care of you and we monitor for a week, we will be able to do that. And it's at no cost if you do the ProCare coverage, So there's a lot of advantages of doing the ProCare coverage, more than just what used to be the cell saver. So I'm coming from Saudi Arabia next month for my surgery. So excited. That's amazing. We get people coming from a lot of places, so that's very, very amazing. Looking forward to welcome you here in Florida, and warm Florida. It's actually, weather is pretty good. It's been warm. El ombligo que tienes ahora influye en cómo va a quedar después de una abdominoplastía. Okay, this is a question in Spanish. I'm going to answer in Spanish and then translate. Sí influye, básicamente, pero siempre va a quedar mejor. Así que de la localización del ombligo, la forma del ombligo, todo eso influye en cómo va a quedar el ombligo después, pero definitivamente va a quedar mejor. So the question is, does the shape and the location of your umbilicus determines the ultimate result? And the answer is yes. Definitely these things do impact your overall results, but always it's going to be better during a tummy tuck, at least when you do it with us. I see, unfortunately, horrible umbilicus around there with patients that have procedures done elsewhere. Umbilicus are something that we are famous for because they look pretty good, and we know how to do them, and it's not as easy. And to make an umbilicus look good, it's not just the umbilicus, it's just the overall shape of your tummy tuck, how it's actually performed. And remember that the umbilicus is a scar that goes in your body. So a lot of times we see these floating belly buttons looking horrible with no definition, like, unfortunately, and this is because not everybody knows how to do this. So we can definitely help you achieve an amazing abdominal shape with a beautiful belly button. But with us, your belly button always gonna look good. So Do you have in-house financing? We'll discover financing. Just we use 2 companies. Go to financing section on our website and you can see a lot of info there. Does it make sense to do a breast and a BBL since I'm only 1 liter if I'll be taken out? I'm BMI 27. Yeah, I mean, if you're a BMI of 27, probably yes, because even a liter will make a very good improvement. When your BMI is over 30, then in those cases, sometimes we'll have you just do the BBL first and the breast later, or separate, so we can remove and transfer the maximum amount of fat. You're one of the best in Miami, and you hooked my first round up so good. Oh my God, I'm grateful. That's awesome. Thank you very much. How long you are booking out? I believe right now we are April. We have some, we just did, with this last special that we did, we fill out most of the spaces for March, and there's a few available in April, and then just send your information and then we hook you up with one of our coordinators and tell you everything about dates. Depending on the procedure that you're having done, because if it's a procedure that is single procedure or it's a quick procedure, then you have some time, sooner. Let's see. Saliba 55. I just had my surgery with you 2 weeks ago and I did amazing. My belly button looks so natural, very impressed. Amazing, good for you. If you wanna hop in here and show us, that'd be awesome. So everybody knows what you're talking about, and look how a 2-week-old belly button will look. So how long are you booking out? Please explain about fillers in the face. So fillers in the face, fillers is a non-invasive, very minimal invasive procedure, I would say, that you can have done at a med spa, for example. But if you're having surgery with us and you had fillers and you liked it, or you're hollowing out and you're losing some fullness, then you might be a good candidate to add fat grafting. Fat grafting is a permanent filler. Fillers go away. Fat does not go away. It lasts you for longer. And when you're adding it to the procedure, you're going to be paying half the price, so it's going to be a lot more cost efficient for you. So definitely consider doing fat transfer. Fat transfer will replump your face in those areas that you have lost volume. Will give you better cheekbones, remove the hollowness that you have here, the baggy eyes. It will give you a beautiful lip contour because we can do fat transfer to the lips. And then you're gonna look a lot younger with fat transfer to the face. It's a great addition to your procedures. Having done. Let's see. Do you continue losing weight after the tummy tuck makeover? It's always best to reach your goal weight or your normal BMI. So even if you have to lose some more weight after the procedure. So yes, you should consider losing weight or getting back to your normal BMI. Do you recommend the broker or what is that for? Well, the broker coverage is absolutely, sometimes it's mandatory. If your hemoglobin is between 11 and 12, you have to do it. If you're over 50, you have to do it. If you're having a combination of procedures, you have to do it because this will cover you a lot of this. I've done a lot of research on your belly buttons and look amazing. I had my surgery done 2 weeks ago. Okay, this is what we read before. Does the excess skin from your tummy tuck also apply? Does the excess skin from a tummy tuck also apply to just 1 liter limit? Yes, anytime we do an incisional surgery that will require for us to make like a long incision, like a breast lift for a tummy tuck, or even a breast augmentation for that matter, we are limited on the amount of fat that we can remove. This is a crazy kind of rule that they put here in Florida, but we are very efficient, and we definitely, if you're on a BMI over 30, you will need to have your procedures probably split out to maximize that amount of fat to be removed. But if you're on a BMI below 30, it's okay probably to combine your procedures. Can you make a tiny waistline with an extended tummy tuck? Yeah, I mean, as tiny as possible. In your case, I guess this is all very subjective. What's tiny for you? Is it achievable? I don't know. These are the things that we can definitely discuss. Send your consultation. We'll give you the best, definitely the best result, but we'll put together the best plan for you. Okay, so what are the post-op care recommendations for the belly button? So we, in general, we don't have you do anything special for the belly buttons. You just have to wash it, soap and water. We'll give you all this information. If your belly button if the scarring around the belly button is different or is going in a direction, then we will provide you different options that you have to do, but it depends a lot on how it's healing. 90% of the time, you're not gonna have to do anything more like just wash it with soap and water when you take a shower, that's it. So we try to, that's another thing that we have done over the years. We try to minimize and make your care for every incision and everything after surgery to be the simplest as possible. So definitely the simplest. Let's see, what does feed the fat mean after a BBL? I don't even know what that means, but this is a principle that you have to consider. The fat cells in the body, after you are like 5 or 6 years old, they don't multiply. It's like neurons. Once you got those amount of neurons, you're not gonna multiply, you're gonna get more. The fat cells, though, if you eat a lot, they enlarge. They call hypertrophy. They grow, each fat cell. So if you go and do liposuction and you remove the fat cells from your tummy and you put it on your butt, anytime you gain weight, you're gonna have more fat cells in your butt and less fat cells here. So the parts that are gonna grow are gonna be the parts that you have the more fat cells. So this is where the people comes into this, feed the fat. So if you gain some weight, you're gonna gain more weight in the areas that you transfer fat than the areas that you remove fat. Or this is because sometimes people say, oh, my arms are getting bigger after in compared to your tummy. But yes, because we did not remove any fat from your arms, then your arms have the same amount of fat that you had before, and when they grow, they look bigger. But that's the point here. Do you recommend Kybella for chin lipo? Personally, I don't. The results do not compare. Kybella results do not compare anything close at all to lipo. Lipo of the neck is amazing. Like one of the other simple procedures that you can, if you have a little bit of a double chin or you don't like that area, then we can definitely do some lipo of your chin at the time we're doing the lipo or the BBL or your procedures. They're very simple to add, and it's definitely worth it, and it's a lot less expensive. Like Kybella, you're gonna end up investing, I don't know, like $3,000, $4,000, however they charge you, whatever you are. With us for chin lipo, I think it's $500. Literally, like, not, it's a given, like, don't even think about it. When can I work out after rhinoplasty? Working out with rhinoplasty is very important not to get a lot of increase in your blood pressure. So I would say you're gonna probably have to take it easy for 3 to 4 weeks, in terms of working out. And just because of that, it's very important because you might end up having the tendency for bleeding, after that. And you wanna get all your swelling and your recovery going. So thinking about 3 to 4 weeks. Any contact sports, probably about 6 to 8 weeks. Like if you're gonna go play the soccer or basketball or whatever contact sport, you're gonna have to wait a little bit for that. How long does a BBL last fluffed? Forever, I guess, depending, or it really, like, once it's full, then you're gonna age and things are gonna sag with time, but you're gonna have a result for the rest of your life, really. So how low do you cut for the tummy tuck? The lowest. So we're famous for that too, besides the belly buttons. Well, the tummy tucks in general. So very low. I've never seen anybody that can lower. So as low as you can cut to make it look good, 4 to 5 centimeters above the labial commissure. No, that helps terminology, but very low. How long is the recovery for a breast reduction, and how long is the procedure? So breast reduction takes about an hour and a half, I would say. A great way of doing this also adding the mesh for the breast. So if you are, it gives you a much better, longer lasting fullness and perkiness, as well as a nicer contour when we use the mesh for breast reductions. The procedure takes about an hour and a half, and the recovery is about a week. In about a week, you could return to do like an office job, driving and doing things like that. So you returning for exercise at a normal lifestyle usually is at 4 to 6 weeks after a breast reduction. Let's see. What factors determine a regular tummy tuck versus an extended tummy tuck? It really it's the amount of excess skin, usually your BMI. Those are the main two factors. How much excess skin you have of your BMI will determine that. It will also determine the length of your incision, things like that, which is kind of common sense. So it's important that you send us your information and we'll tell you what you need. Do you correct botch surgeries? Unfortunately, yes. Those are difficult though. Don't get a botch surgery. Come to us or go to a good place for the first time so you don't need to repair anything. It's a lot more expensive and difficult to have to fix it, and it's very likely that you will not get the best results even after fixing it, like you would having the thing done right the first time. So look, do your research. That's why you're here. You're listening to these conversations, learning a lot, and go online, look at the reviews, look at the work that they are doing, and then make your decision. Okay? So do you do jawline implants? Yeah, we definitely do chin implants. So that's another surgery you may be able to add to other ones. So yes. Let's see. How long is the recovery for your breast? So we did that one. How long after multiple procedures do I have to wait to be able to carry my little one? It's 30 pounds. So I would say to lift or to carry something at 30 pounds, you should think in about 4 to 6 weeks. Now you can probably get some help and get people to put it in your lap or things like that. Yes, but if it's 30 pounds, that's already a little bit heavy, So yeah, definitely you should consider that. Where are you located? We are located in South Florida. This is Fort Lauderdale. This is about 20 minutes from Miami. So, very close. Our airport is more accessible than the Miami airport. If you're coming to South Florida or to Miami, I will recommend for you to book flights to Fort Lauderdale instead of Miami. Miami airport is crazy. So anyway. Can you say happy birthday to my sister Annie? Absolutely. Annie, have the best of the birthdays. How old is Annie? Do you do Mons lift with the tummy tuck incision? So Mons lift, the lifting of the Mons is definitely something that is included into the tummy tuck. The tummy tuck includes the fixing and the lifting of everything that have fallen, below the belly button and then the suprapubic area. So yes. How long do you have to stop smoking before a tummy tuck? Our recommendation is 1 month before and 1 month after. That will give you a safer time of healing before. Tummy tucks are very sensitive to smoking because they end up having worse scars, open incisions, and things like that. So you really want to pay attention to that. The longer you can wait, the best it is. Can you say hi to Turkey? Obviously, hi Turkey. All the Turkey fans. Yeah, I see people from Argentina, from Chile, from Saudi Arabia that looks like they are coming. United States, obviously. Wisconsin, it's amazing. Today I did surgery on a couple of patients from New York. They're escaping the cold. South Carolina, There's a lot of people from the Middle East too. That's awesome. You know, people from Iran, people from Turkey, people. Let's see. How do you prevent keloid after tummy tucks? We usually, well, keloid is a problem. It's people from Puerto Rico. The keloid is a problem of the scarring of the patient. Here's Brazil, and the way to prevent it is if you are prone to keloids, we inject Keloid. You know, we inject steroids. But we don't. If we don't know, there's not a lot of things we can do to prevent it because we don't know you're gonna have a keloid. But if you do, we'll tell you. We will provide in our package. We will provide you a silicone cream that you will start using usually about a month after, and that's, you know, to minimize your scarring. So definitely that will help so you don't develop any abnormal scarring.
People from Chicago, Houston are saying hi, Brazil.
France here.
France.
Oh, by the way, I was in Paris last week
Best
and
city in the
London.
world.
Amazing. You know, like first time in Paris. Oh my God, what a city.
So
And you know, I'm from Buenos Aires, like Lily and Bertie, and I tell you, like it's one of the closest things that I've seen to Buenos Aires. Obviously, in my opinion, much nicer. You know, Paris is like unbelievable. It's great. London too. London is quite a city as well. So much history. Pretty amazing. Is there a BMI limit for chin lipo and arm lipo? Not for that in particular, but you know, there's a BMI. We can't do any surgeries on patients that are over 40. So definitely one of the things that you have to keep in mind. Send your information. Minor from Brazil, Max South from London or from UK, guess. Let's see. Is there can I have a tummy tuck BBL lipo 360 all at once? Yes, we do that every day. So definitely you can definitely do that. BBL, 360 lipo. We do all those combinations, tummy tucks, BAMs, you know, breast augmentation, mastopexy. How long is the surgery time for extended tummy tuck BBL and breast augmentation, mastopexy? With us, I always say this, the great rule, thinking about 1 hour per procedure. So 3 procedures, 3 hours. You know, it's a pretty good estimate in our setting, not everywhere. So I am 41. Can I have lipo and a BBL at the same time? Yes, absolutely. You're very young. 41 is really young. So yeah. Let's see. Can you do consults over the internet? Yeah, that's exactly how, again, you know, you can just send your information, send your pictures on the form, and then we'll get back to you with a quote just for you, revised and seen by the surgeons. So that's the best way to do consultations with us. And yes, it's free. How do you guys do it so fast? Because we have an amazing system. You know, yes, it's pretty fast. But the trick is not doing it fast. The trick is doing it right. You know, and obviously if you do it fast and right, then amazing, you know, because you don't have to spend a lot of time under anesthesia. But yes, you know, we are actually very efficient.
what is your
But
efficient pulse?
not only not only we are efficient on the surgical part, but we are very efficient before surgery and after surgery, which is the important part, you know. So that is definitely something very, very important, that we are efficient everywhere, and especially in the post-operative process. When you stay with us, we're gonna watch you. We're gonna make sure you're doing great, that you are, you know, safe. You're being cared for under our supervision for about a week in a hotel room on the privacy. We'll bring you the massages. We'll go see you. We'll care for you. You don't get this everywhere, almost like anywhere, and definitely not for our pricing. So make sure you do your research. Okay, we answer the stop smoking after any procedure, 1 month before, 1 month after. Nos vemos muy pronto desde Wisconsin. Ojalá. Aquí te esperamos en Florida. Can you do a consult over the internet? We did that. I have a flat booty. Can you give me a bubble butt? Maybe it depends on how your skin will stretch. So if you have stretchy skin and enough fat, we can likely give you a booty, like a bubble booty. But if you don't, and if your skin, the main restriction we have is how your skin tightening is, how tight your skin is. So do you do lipo, the tummy tucks, lipo, the tummy, with tummy tucks and BBLs? Yes, of course. You have to. I mean, if you want to get a nice result, we do lipo, the tummy, the flanks, and the back, and then, we'll do the fat transfer, for the BBLs. And that combination is very common. Let's see. Okay, last few questions. What should my BMI be for a mommy makeover? Usually below 32, but the best way to answer these questions just for you is when you send us your information on a consultation, in a free consultation on the website. So we'll give you all you need, and we'll see if you're a candidate for that. Do you recommend lifting for young patients if the skin is loose? I don't know what kind of lifting you're talking about. If you're talking about facelifting, talking about young persons, I think that's what you're referring to, or breast lifting, or butt lifting, or what kind of lifting. So you just tell me that. Let's see.
Financing for Canadians.
I think the financing has to be done here in the United States. Financing for Canadians, they have done it, but in Canada. So, you have to probably find the financing where you are from. Okay, let's see. All right.
Facelifting, sorry.
Facelifting, yeah, so facelifting, yeah. Well, again, the only way to tell you is just to see you and see your pictures. So, yes, I've done facelifting patients in their 40s. I think that's pretty young. I never done facelifting a patient in their 30s. But when you start having some sagging, then that's possible. But, again, in patients, there are other things that we can do in patients that to help that without having to, go to a facelift. Let's see. How soon do you recommend lymphatic massages? Lymphatic massages should start the day after your procedure. So yes, definitely we recommend to have your lymphatic massages starting, if you stay with us, we start the day after, and then we'll do that. Definitely, we recommend for you to continue the massages during the first 2 months. How long are you under anesthesia for 360 lipo and arm lipo? An hour. Not too long. Cuando usas una Depo injection para el control, ¿cuánto tiempo antes debes dejar de usarlo? Normalmente recomendamos 2 semanas a 1 mes, si es posible. 1 mes es mejor. Ese tipo de inyecciones o cualquier terapia hormonal te dan más tendencia a hacer coágulos. Por eso es importante. Igual nosotros nos encargamos de eso, pero... so the question in English was, if you're using those Depo injections for birth control, then how long you have to stop using it? And we would recommend if possible, like 2 weeks, or a month is better. So we are taking any sort of hormonal therapy will make you more prone to develop blood clots. Although we take any precautions for that, then we're trying to minimize anything that will make you more prone to developing blood clots. Anyway, so we reached the hour here. Actually, one of our accounts had stopped. But again, we are happy to answer all these questions and continue to answer questions. If there's a questions that I did not answer here, you please just DM us and we're happy to answer you. So, continue to do that. So it was great to see you. Remember to check our YouTube channel. We have a lot of the same information that you're hearing here in the lives there, and we'll be popping again next week with more information. Thank you everyone for tuning in today. We will see you very soon. Hasta la vista.